remote working, remote e-commerce, remote airline ticket purchase. What next? Remote autism assessments? Hello there, friends of Ai4Autism. Hello, hello, hello. In this episode, we're taking a look at the Spectrum news article, Evidence for Remote Autism Assessments Trickles In, by Laura Dettaro. So let's begin. In March 2019, Zachary Warren launched a clinical trial of a virtual tool to diagnose autism in toddlers. He had hoped to find out whether it could improve access to autism services for families who live in rural Tennessee and West Virginia, hours away from his Nashville clinic in Vanderbilt University. A year later, the coronavirus pandemic shut down in-person assessments for everyone, and his work took on new significance. When Warren started his trial, few rigorous data existed on the efficacy of diagnosing autism through a computer screen. Now, more than 3 years later, those data are surfacing and a positive picture may be emerging, not only for Warren's tool but for other strategies as well. There is a sizable percentage of young children on the spectrum where we are going to be able to accurately confirm the presence of autism profiles based on telehealth visits, says Warren, Director of Autism Research at Vanderbilt. There is no doubt that that is the case. But he and others say it remains unclear which tools work best and for whom, and some providers remain unconvinced. Meanwhile, the ability to gather more data on telehealth's efficacy may be vanishing fast. At the start of the pandemic, the Federal Centers of Medicare and Medicaid Services added some psychological evaluation to its list of approved telehealth services, a list that guides payment decisions by many state Medicaid programs and private insurance companies policies, says Stephen Gillespie, Senior Director of Health and Healthcare Financing at the American Psychological Association, which is advocating for expanded access to healthcare. But that provision, which made remote healthcare mainstream, is set to expire at the end of 2023. Other than those of us who are starting trials for this, it will be easy for telehealth to get forgotten, says Catherine Stavropoulos, Associate Professor of Special Education at the University of California, Riverside. That's important to try to avoid if we can. It's not as though the issue of access is gone because COVID is over. Stavropoulos, Warren and others are pushing ahead to integrate virtual measures into Autism Assessment Toolkit, predicting it will deliver such benefits as shorter waitlists and fewer diagnostic barriers. The cat's out of the bag, Warren says. It's no longer a question of will we use it, it's more of a question of understanding how best to use it. Once the pandemic exceptions expire, Medicare will reimburse virtual visits at a lower rate than in-person ones, and other insurers will most likely follow suit, says Gillespie. With such high demand for services, there is no justification to revert to lower reimbursement rates, and plenty of indicators suggest the rates need to increase, Gillespie wrote to an email to Spectrum. We see access to telehealth and reimbursement for telehealth at the same rates as in-person services as health equity issues. More data could help bolster that argument, says Elizabeth Krishak, a psychologist at Nationwide Children's Hospital in Westerville, Ohio. Warren's trial, which evaluates a tool he developed called the Tele-ASD PES TAP, directly compared in-person remote assessments of the same 73 children. After the two evaluations, 68 children, 61 with autism, 7 without, and the same diagnosis for both. 4 received a diagnosis in person, but not virtually. And our diagnosed virtually was what ruled out in person for an agreement of 93%, according to unpublished results presented in May at the 2022 meeting of the International Society for Autism Research. Moving forward. So how much we will account for the pandemic is still something we need to understand before we say it's something related to telehealth, specifically Villalobos, who is Associate Professor of the Pediatrics at the University of Utah in Salt Lake City, said. More evidence could help ensure that any person or family would be able to access autism services regardless of socioeconomic status, Stavropoulos says. I feel strongly about any research we can do to make stuff closer to that ideal, she says, and I think telehealth can do that. It's quite a lengthy article with quite a bit of statistics there. But in essence, we have the possibility of a remote assessment tool. And this goes hand in hand with some of the other videos and topics we've spoken about, where as the demand increases, how are we going to enter all of them? Will it have to be in person, or will it have to migrate to reliable online services? Perhaps that can use AI. What do you think? Thanks for watching, and remember, love, life, and AI.